Hey there, welcome to Let's Make a Health Connection. In this podcast, we introduce, interview, and showcase the many healthcare providers and resources that we feature on our website, localhealthconnect.com. I'm Jennifer Barber, and I'm a licensed clinical social worker in Washington and Oregon, and I'm happy to be part of the Local Health Connect provider community. Hi, everybody. My guest today is Brendan Rowe, one of 3 owners of TMS Northwest and MedRx Partners. Brendan has been practicing psychiatric medicine across the lifespan for the past 9 years. Prior to working in psychiatry, he spent 7 years as a nurse specializing in pediatric and adult hospice care. For graduate school, Brendan attended Arizona State University, where he earned a Doctor of Nursing practice degree and a Master's of Business Administration. He received additional training and certification in TMS through Duke University's Visiting Fellowship. He is an outspoken advocate for mental health care and is passionate about a variety of social justice issues facing the community he serves. Thank you so much for being with us today, Brendan.
Thanks for having me.
That was a mouthful. You've got quite a history.
Yeah, definitely. One thing that I wanted to clarify on that history is that I'm a psychiatric mental health nurse practitioner. We call it a PMHNP.
Yes.
So I can prescribe medication and diagnose and treat all sorts of psychiatric disorders across the lifespan.
Perfect. Thank you so much for clarifying that. You're here today to talk a bit about TMS Northwest. And I want to just remind you that, there may be some people out there who have no idea what TMS even stands for. And so I think we kind of need to start at the very basics and just explain to us, what is TMS?
Definitely. Yeah. So TMS stands for transcranial magnetic stimulation. So it's where we use an MRI strength magnetic coil and we stimulate different parts of the brain. So if we're talking about major depressive disorder, we stimulate the left dorsolateral prefrontal cortex, where depression's rooted, so that front left part of the brain. It's not ECT, electroconvulsive shock therapy. There's no shock. It's just a magnet and a very strong MRI strength magnetic coil, pulsing and stimulating an action potential. So what I mean by that is getting those neurons firing again and helping them rewire and normalize what's become abnormal due to chronic stress hormones and environmental factors and a million different, there's a million different reasons that a person can end up depressed, but what we're trying to do is normalize your brain chemistry to help, reclaim your life.
Mm-hmm. I love it. I can imagine when people hear that, it may sound a little bit scary.
Yeah, I think so, until they see it, and then until we talk about it, and then it just seems like we can mitigate most of those fears.
Yeah. So tell us a little bit about TMS Northwest and how it got started and what services you have to offer there.
Yeah, definitely. Okay, so TMS Northwest is the name of our company. We got started back in 2017. Kind of a long story, but basically I was exposed to the science of TMS and really dug into the efficacy of TMS at a conference, and just really became fascinated by the data, right? And thought it was too good to be true. But the more I looked into it, the more I couldn't let it go. And so I brought the idea of partnering with a couple providers that I deeply respected. I brought that idea to Dr. Julia Swafford and Piper Bursmeyer back in 2017, and they also became intrigued, and we decided to move forward. I think what really piqued our interest is, we were all med providers in the community providing psychiatric services across the lifespan, all ages. And the one thing that frustrated us most is, what do we do for our clients who have tried, 3, 4, 5, 6, a dozen medications? What do we do for them? And they're still depressed.
Yeah, and frustrated.
And wanting to give up. And they've been in therapy for not just, weeks, but for years. What do you do for that client? And So TMS provided us a non-invasive option to treat that depression. It's also indicated for other psychiatric disorders like obsessive compulsive disorder, smoking cessation, migraines. I mean, there's, it's more than just depression, but I tend to talk about depression the
Sure.
most because
It's
it's my passion.
fascinating. Mm-hmm.
Yeah. So that's where it started, is just wanting to offer something besides medication and therapy to those really sick clients. And then it went from there.
Very cool.
Yeah.
Can you tell us what makes TMS unique to mental health treatment?
Yeah, transcranial magnetic stimulation, or our clinic. So TMS, I guess, right? So TMS, yeah. What's different? What's unique is that it's non-invasive. It's non-systemic. So what I mean by that is, if I prescribe, let's say Zoloft, an antidepressant to a client for their depression, well, I can't control where that medication goes. It's going to attach to all the serotonin receptors.
Right.
A large part of our serotonin receptors are heavily saturated in our gut, not just our brain. So there might be gastrointestinal upset. Someone might have nausea, they might have diarrhea, they might have constipation. Other side effects might be decreased libido. I mean, you name it, headaches. There's a variety of systemic side effects that come along with medication potentially, right? So the beauty about TMS is that the MRI strength magnetic coil doesn't penetrate below about 5 centimeters from the site of application. So it's not reaching the level of your heart, your kidneys, your gut, so you're never going to have those systemic side effects. So that really separates, or sets it apart
Oh,
from
big
other
time.
treatment options.
Yes.
Um, another you know important factor, or fact that sets it apart, is the remission rates. So a person who has tried, let's say, I'm just going to speak to depression. OCD is very similar in terms of the data, but let's just talk about depression to be general. So someone who has depression and they've tried let's say they've tried 3 antidepressants, the likelihood of them achieving remission of their symptoms, so to be completely free of depression by the time they try their 4th antidepressant, is less than 7%. The odds of achieving total remission of symptoms with TMS goes up to 60%. And at our clinic, our data suggests that our remission rates are more, like 65, 70%. That might be because we have additional services, like we offer a TMS workbook. It's like cognitive behavioral therapy while you're getting TMS. We just wanted to maximize those results. We also do something called medication optimization. So what I mean by that is, if we have someone who has insomnia, or we have someone who has ADHD and it's poorly managed, well, I might try to manage those concomitant disorders. And then obviously, by managing someone's anxiety or their ADHD or their insomnia, their depression is also going to improve. So I think that could explain why our remission rates at our clinic are slightly higher than the national average. But still, TMS alone, 60% remission rate versus 7% with the 4th antidepressant. I mean, I'll definitely take TMS any day.
It sounds amazing.
Yeah.
Absolutely amazing. So I'm just wondering, can you walk us through what it might look like for somebody to come in for a first appointment, or maybe even a second appointment, because that first appointment might be more like assessment and, really zoning in on, what we're going to do after this. But those first 1 or 2 appointments, what could somebody expect after they've made the call, they've got on your schedule, it's now time to come in? What does that look like?
Yeah, I mean, the very first appointment is a psychiatric evaluation. So we really dig into your symptoms, and I try to identify anything else that could be contributing to your depression. So again, unmanaged ADHD, if there's post-traumatic stress disorder, and then I try to go through your symptoms with a fine tooth comb and differentiate between bipolar depression, unipolar depression. Just really make sure that I understand what is happening in your situation, and then we devise a treatment plan. So that's where the medication optimization might come in. If I think that we can do better with your medications than than your current regimen, then we will. So and then we'll talk about options like, is TMS a good fit, or do we need to go a different route And so we'll discuss that. But the first appointment for TMS, so day one of treatment, consists of something called cortical mapping. And that's just where I will come in and map out exactly where the magnetic coil needs to be placed. So I try to find the primary motor cortex. That's essentially the part of your brain that's involved in um, the muscle movement of your right hand. So I'll cause your right hand to twitch involuntarily. Kind of feels odd. Nothing we do is painful. Um,
I'm glad you
it,
mentioned that. That was going to be one of my next questions.
yeah, it's not a
No pain.
zap. It's not painful. Annoying, maybe. It can be annoying. It feels like a little, someone's like a little flick on the scalp or a little tap. I always jokingly say a woodpecker is tapping on your scalp. So just, so that might be annoying. It may not. Um, but so then I'll cause the right hand to move involuntarily, and that just helps me identify exactly where I'm at in the brain, and it helps me basically get to the left dorsolateral prefrontal cortex. So I map out exactly where the helmet needs to be. Then we find your dose, which is essentially, we call it the motor threshold, and that's the lowest setting possible that still gets those neurons firing. So once we identify where the helmet needs to be placed and what your dose is, then we proceed with your treatment. So on day one, you're actually getting your very first treatment.
Great.
And so for treating depression, there's actually 36 treatments involved in the whole protocol. Each treatment lasts about 19 minutes. So you're pretty much in and out of the office. TMS does not impact your ability to drive a car or to function. So many people will come before their shift at work or on their lunch break or right after work. And so we typically have half-hour appointments throughout the day. The first one at our clinic is at 8:30. The last one starts at 5. We have 3 devices, so we can generally accommodate most appointment start times.
Did you say how many treatments for a full
Yeah.
treatment schedule?
Right. So for the depression protocol, it's Monday through Friday. Each treatment's 19 minutes, right? But the schedule is Monday through Friday for 36 treatments. So
Gotcha.
really, you're looking at 7 weeks of treatment. So it is a time commitment. I mean, fortunately, you're in and out, right?
Right.
But it is something that you have to commit to. Each treatment does build on the last. And so it's not something that you want to do if you've got a vacation coming up or some event, like and you
Right.
have a week. I mean, life happens, and we just came out of a pandemic, so I understand people get sick. And so what happens in situations like that, we'll add treatment to the very end of the protocol so that you still get the same amount. But really, truly, if you can't take a vacation in the middle of
Right.
treatment, it's going to interfere with your progress.
Yeah, there's some planning involved for sure. And then once someone goes through all 7.5 weeks, is there the expectation that they would need to come back in every once in a while for a tune-up, or are they good to go?
About 3% of our clients return for additional treatment. The vast majority of people are good to go. Again, we've been open since 2017, so we have about 5 years of data. That's not to say that more, won't return. But among the clients who do return, they typically report that it was like the best year that they had, in the last
Wow.
decade, right? And then so that's why they're returning. They started to feel the return of depression, and wanted to catch it early. They knew that TMS worked, so they wanted, so they returned for additional treatment. So,
Wow.
and I've noticed we've had clients return 3 and 4 times now, and it does seem like each time they return, the effects last longer. So it might have been that they had 8 months of, where they felt depression free after the first round of TMS. And then the next time they got a whole year out of it, or a year and a half. I mean, it does seem like there's a trend there. But that's a smaller minority. Like I said, about 3% of our clients.
Gotcha.
The vast majority, we know from the research suggests that it can be permanent, the neuromodulation. So we do know, this is an interesting fact, that although the treatment itself is 36 treatments, right? So 7 weeks, know that the neuromodulation, that remodeling and normalization of the brain, that can actually continue for up to 12 months after you've stopped treatment.
That's
So
incredible.
it's not uncommon for me to see continued progress 3-4 months out when I do a follow-up.
That
Hmm.
is incredible. Our brains are amazing. And
Aren't
oh
they?
my
Yeah.
gosh, just amazing. So you've talked a lot about, certain candidates for TMS treatment, depression. Did you say OCD?
Yep. So treatment-resistant obsessive compulsive
Okay.
disorder.
Anybody else that would be like a prime candidate if they're listening to this? They might say, "Oh, that's me."
Smoking cessation. So people who have tried other means of, they've tried medication or non-pharmacological means of trying to quit smoking and they still need to quit. Um, and migraine, there's a migraine treatment protocol as well. But really our passion and our true focus at our clinic is major depressive disorder and obsessive compulsive disorder.
Gotcha.
Those are our two kind of, you know,
Gotcha.
babies there.
And you've talked a lot about what clients could expect from a treatment course. Is there anything else that you might want to just say, if you're going to go through this, this is what you can expect?
Yeah, at our clinic, we like to consider ourselves, or we like to provide boutique level care. I mean, that's what we always say, and it's just really what we mean by that is that it's patient centered. So, um, I think at most clinics you might come in and you're just treated like another number. You're someone who has major depressive disorder. You're going to go through the depression protocol, and that's that. But at our clinic, we're gonna manage your anxiety. If you have anxiety that's really disrupting your ability to achieve remission with depression, we're gonna take care of that. We're gonna take care of your insomnia. We're gonna look at the whole picture, and create an individualized treatment plan. One thing that's very different and unique about our clinic is that we always have a medical provider on site. Whereas most clinics don't. Most clinics, their provider is remote and they might have a technician running the clinic. And we just don't believe in that. We believe that you should have direct access to us at all times.
So that leads me to my next question. If someone has been working toward mental health for quite some time, they may come to you already with a team in place. They may have a prescriber, they may have a therapist. And
Yeah.
I'm wondering if somebody comes in to the clinic and they say, I want my therapist to be involved or I want my prescriber to be involved. Do those people continue working with this client that's now coming to see you, or do they hand off to your clinic for a full, multidisciplinary engagement with just your
Yeah.
clinic?
We love that. And that's best case scenario. We love to collaborate with other
Right.
providers. We're not here to steal your client. We want the therapists out there and the other med providers out there to refer their most difficult, challenging clients. I know as a med provider, I know what it's like when you see that client on your schedule that you've just not been able to you haven't been able to make a dent in their depression and they're coming back to you week after week or month after month, right? And you just know that they're going to be suffering, and you just feel, um I just remember feeling like, what else can I do, and hopeless
Right.
almost as a provider.
Right.
I want the providers in the community to send those clients to us and we can stabilize them and then refer them back to you. We're not here to steal your clients. For those patients who are self-referred or don't have a team of providers outside of our clinic, we don't provide ongoing medication optimization at TMS Northwest, but we do own another clinic called MedRx Partners. It's right next door, and that's where we do long-term medication management. So we always have openings, which is a surprise to
Right
most
now,
people.
for sure. Yes.
Openings right now. We have about a week wait for an evaluation. So we can definitely refer to MedRx Partners and get someone taken care of if they need a support team. But we love to collaborate with providers in the community. And so the nice thing is that because the patient is coming to us 5 days a week for 7 weeks, if they need an adjustment in their medication, if we see if that makes sense to us, then we can just do that and we can collaborate with the provider as well.
Great.
We're not going to send them back to their provider and so that they have to, um, you know, go to 2-3 medical appointments a
Right.
day. That's
Right.
nonsense.
Yes. Um, is there anything else that sets TMS Northwest apart from its competitors?
Yeah, I mean, like I said, the medication optimization is
Yeah.
unheard of, right? Having a medical provider, like a licensed, nurse practitioner, or that's just unheard of. Having us on site. Um, all of our technicians that run the daily treatment are CNAs or medical assistants. That's also unheard of, surprisingly, because a lot of clinics might just hire a non-clinician, someone with no mental health background, maybe an accountant that they know, a family
Right.
member. They can be trained and become a CNA, technician. We find that unacceptable, and so we definitely have a higher standard of care at our clinic.
Okay. Anything else you want to tell us about TMS or TMS Northwest?
I think that a big misconception is that it's pseudoscience or something new. It's not. It's been around since 1985. We have long-term data to support its safety, to support its efficacy. So we know it works. It's part of evidence-based medicine. So if you've tried, 2 antidepressants or more, if you've been through 6 to 8 weeks of therapy and you're still depressed or you're still struggling with OCD, you need to come to us, reach out sooner than later. The data suggests, I mean, it's indicated for treatment resistant depression, but the data suggests that moderate depression can have a robust response as well. So the sooner the better, that's our thought.
Practical question.
Yeah.
Does insurance cover this?
Yeah, insurance does cover it. I've not found an insurance company that doesn't. Including Medicaid. That's something that really sets our clinic apart too. We're not just out to make money. We're not just out to serve commercial insurers. We have created a spot for Medicaid. So our heart goes out to Washington Molina clients. They usually have very severe symptoms and need our help, and there's very few resources. We were pioneers in this community. We were the first to open a clinic in Clark County, in Vancouver. We were also the first to open a clinic in Cowlitz County. So we have a clinic up in Longview.
Great.
And I believe we were one of the first clinics to open in Washington County. So we have a clinic down in Tigard. So
Great.
we are most likely in your area if you are in, if you live
area.
in the
Yep.
area. So yeah, so we are accessible. If you need our help, reach out and we can have you come in for a consult.
Where exactly is your Vancouver site? Let people know where they can find you.
Yeah, the Vancouver site is about a mile east of the Vancouver Mall, right off of the SR 500 and Gare Road.
Okay. And where can people find you online?
They can find us at tms-nw.com.
Great.
tmsnorthwest.com.
Brandon, thank you so much for meeting today.
Thank you. I appreciate it.
Thanks again for listening to Let's Make a Health Connection. Find us online at localhealthconnect.com, as well as Facebook, Instagram, and Twitter. Links and show notes for this interview are available on our podcast page. These interviews are really fun, and I hope you made a health connection today. We'll talk again next time.
Let's Make a Health Connection, copyright 2022, all rights reserved, is the exclusive property of MBS Therapy, LLC, a Washington-based company. Local Health Connect is inclusive and does not endorse any political or religious group. Thank you again for listening, and we'll see you next time on localhealthconnect.com.